ADHD, or Attention Deficit Hyperactivity Disorder, is a mental and neurobehavioral disorder characterized by either significant difficulties of inattention, hyperactivity, or impulsiveness, and is the most commonly studied and diagnosed psychiatric disorder in children. Although only affecting a small percentage of children globally, ADHD isn't diagnosed in up to 16% of school-aged children in America, with up to half of those diagnosed during their youth carrying symptoms into adulthood. ADHD symptoms can be difficult to differentiate from other disorders, increasing the likelihood that the diagnosis will be missed. Adding to these chances is the fact that most clinicians have not received formal training in the assessment and treatment of ADHD, particularly in adult patients. Opinions regarding ADHD are diverse, from some believing it doesn't exist at all, to others claiming that there are genetic and physiological bases for the condition, and that it therefore should be treated as a medical illness. Possible overdiagnosis of ADHD, the use of stimulant medications in children, and the methods by which ADHD is diagnosed and treated are some of the main areas of controversy. While ADHD management usually involves some combination of medication, behavior therapy, lifestyle change, or counseling, many advise that only children with severe symptoms should be considered for medication as a first-line treatment option. The biggest long-term study of treatment for children with ADHD, called the MTA study, treated nearly 600 children in the late 1990s for 14 months to compare the effectiveness of several different protocols, medication, behavioral treatment, or both. The study showed clearly that medication reduced symptoms more effectively than behavioral therapies, and that adding the behavioral interventions didn't improve the result significantly over medication alone. While debate in the scientific community does agree around the MTA study results, there is less agreement on a related issue, which is whether kids develop tolerance to stimulant medications over time and therefore need an increased dosage to get the same effect. Some research raises questions about the long-term effectiveness and side effects of these medications, as their usefulness is largely unknown because of the lack of long-term studies related to the medication. In a follow-up analysis of the MTA findings, it was found that dosage increases were required in over half of the medication-only group, with the dose per unit body weight increasing on average 19%. Similar findings also appear in a 2-year study of more than 200 kids on Concerta, in which the effectiveness of the medication was maintained successfully through the second year, but an increased dosage of 15% per unit of body weight was needed. Because the effectiveness of these stimulant medications are unquestioned to many professionals, they often prescribe it as an instant and easy fix-all, and often children are much improved behaviorally because of it. Because of the quick results that medications give, doctors are more likely to prescribe them while other treatment options may be more involved or time-intensive. While some professionals admit that the tolerance one's body builds to stimulant medications may cause harm, because of the efficacy of the treatment and the short-term period of being medicated for the child, it is still the first line of treatment for many. Because of this, many doctors agree that the possibility of developing tolerance over the long term doesn't undermine the value of the medication for children with ADHD in the short run, when it may very significantly improve their lives. A favorite opinion in the health field is that many good medications become ineffective eventually, and that one shouldn't justify giving medication to kids based on what it is going to do 10 years from now. Still, when parents are presented with the situation of watching their kid fail out of school or having the ability to do something about it now, medication will almost always be the preferred option. This isn't to say that other, non-prescription treatments can't be effective, but the truth is that medication, whether it be alone or in combination with therapy, is the best treatment we have now for ADHD. Considering that ADHD is a relatively new phenomenon, much of the information and research studies we have regarding these medications lack long-term observations and are not conclusive yet. Still, many doctors are